Nice to meet you. This is Jindong Kim from Gachon University, and it is really an honor to me to present my study here. So, uh, doctors of Korean medicine, KMDs, always make clinical decisions. But actually, we don't know about the exact logical process of clinical decision of KMD. So, we can call it as black boxes. So this is my research question. How can we translate clinicians' intuitive process into clear mathematical equations? To answer to this question, we use explainable AI tools. XAI is a set of methods that can open up the black boxes of the AI model. And this is the overview of my study. And at first, we prepared data, and then we made a model that can predict the clinician's decision making. And then we used XAI tool to look inside of the AI model. So to make the data, we recruited 100 patients with allergic rhinitis. And then we collected questionnaires from them. And then a single KMD labeled one pattern and one prescription from these options. So now we have data, and next part is about modeling. And we wanted to make a model that can learn the clinical decision making of single KMD. So we used TAP-PFM model, and this model is really robust, very strong for small table data. So we trained this model and assessed the performance. And this is the result of prediction performance. The blue one is the prediction performance of pattern identification, and the red one is prediction performance of prescription. And it had about 64% and 42% of the accuracy. And then we applied XAI approach to look inside of the black boxes. So at first, we used SHARP method to identify some key features in AI model, and then we used symbolic regression to discover some mathematical equations. So these are the key features of pattern identification model, and we can see that there are some features about cold heat pattern, 한열 pattern, and dry damp pattern, 조습 pattern, and other features. And this one is prediction model for prescription, and it had some similar pattern of features, but it had more patterns about nasal symptoms, local symptoms. And next, we used symbolic regression to extract the equations. There are several models we can extract mathematical equations, but today I want to show you pair model and 현계연결탄 model, for example. And this is the equation from pair model. And there's X9 feature here. X9 feature means avoidance about coldness, 1. And we can see that there's minus sign in front of this feature, and it means it's negative indicator for classifying pair. And this is equation for 현계연결탄, and in the same way, X12 feature, preference about cold water, can be interpreted as a positive feature for 현계연결탄 prescription. So there are other equations extracted. And through SHARP method, we could see the holistic paradigm of Korean medicine because most of the key features were about systemic symptoms, not about local symptoms. And through symbolic regression, we could see how systemic indicators and local symptoms can be combined mathematically. And in the future, we're going to make a tool for KMDs, which can give some self-reflective feedbacks. And these are limitations of my study. And thank you for your attention.